Welcome to the Speaking of Women's Health podcast. I'm your guest host, Lee Klecker, the producer of the podcast, and I'm happy to be back in the Sunflower House for a new podcast episode with Dr. Matthew Kampert. I'm talking with Dr. Kampert in this new episode about exercise as medicine for women. First, I'd like to share a little bit about his professional background, and then we'll dive into the episode. So, Dr. Kampert received his undergraduate degree from West Virginia University. He went on to earn a graduate degree in exercise physiology at West Virginia. And he then attended Lake Erie College of Medicine for his medical degree and went to Cleveland Clinic's South Point Hospital for his residency in family medicine. Then he decided to do a fellowship in sports medicine at Cleveland Clinic and was appointed to Cleveland Clinic shortly after in 2020 in the sports medicine department. So, welcome, Dr. Kampert.
Thanks for having me.
Of course. So, as I mentioned, we're going to be talking about exercise as medicine for women in this episode. And we've done several previous podcast episodes about food as medicine. So, I think this is a great topic as we're all, in this new year, hope maybe setting some resolutions and thinking about maybe some ways we can live healthier or maybe a new exercise regime. And as we know from several other podcasts with our guests and Dr. Thacker, women who exercise, they regularly have a lower risk of death from all causes, including cardiovascular disease. And we've also discussed many times on this podcast how exercise can help with mood as it releases endorphins and helps you to feel happier, maybe more relaxed. And so these are just a few examples of how exercise is beneficial to our health. But I think we're going to start with bone density and osteopenia and osteoporosis. So, Dr. Kampert, how can regular exercise help strengthen our bones or prevent bone loss? And do you want to talk a little bit about bone density and how that all kind of works together?
Yeah, so exercise plays a huge role and really across the lifespan. So you only have so many years to really lay down bone density. Usually around age 26 is peak bone density for females, and then your hormones and things change. And then really the goal is to minimize bone density loss. You can always try to add a little bit, and there's medications that help with that. I won't go into much of that, but really the type of exercise is resistance training or things that load the bone. So not all exercise is created equal, and with the approach that exercise is medicine, you have to have the right dose and the right prescription.
Mm-hmm.
So you need to load the bones. Aerobic exercise, you get a little bit of loading of the bones with running, but cycling, you really don't load the spine. You can stress the long bones, and then swimming's great exercise, but you're really not loading the joints or the bones or the spine. So you could actually lose some bone density in the spine from cycling and lose bone density from swimming. If you think about space travel, one of the things they worry about is muscle loss and bone density loss because you don't have the effects of gravity. So your body really does like the bones to be stressed appropriately, and then they respond. So by doing things like resistance training or load-bearing exercises, even proper squatting mechanics and loading that spine or rucking, you can increase the bone density in the spine and throughout the whole body. And you want to make sure that you have adequate calcium and vitamin D also with
Mm-hmm.
that process.
Right. So you said that running could be considered a resistant exercise. What other examples can you provide?
Anything that where the body's being loaded. So why running
Okay.
does it is because you have the effects of gravity, and then when you're
Okay.
running, you have the impact forces, so all that jarring of the joints and everything. But really, resistance training, where you're really loading the muscles, so where you're lifting heavier loads, so more than your activities of daily living.
Hmm.
So you could carry bags around throughout the day, but if you're lifting weights, you can only do a certain number of repetitions. So it's a heavier load, it's a larger stress on the bones, but not the type of stress you would want all day.
Hmm.
So any type of resistance training will help the bones and the joints that you're loading.
Hmm.
But if you're only doing things for the lower body, like leg extensions and leg presses, you have to remember you're not loading through that spine and you're not loading the bones of the upper extremities.
Hmm. So yoga, would that be a good one? Because you kind of seem to be using your whole body.
Yoga has a lot of health benefits, but I wouldn't identify that as one of the key ways to build muscle or to load the bones. I mean, because you're really not increasing the force as much more than the force of gravity.
Hmm. So weights, and then but making sure, like you said, just don't stick to, legs all day or legs every day, whatever the saying is. But
Yeah.
arms, shoulders,
You want to load all the
back.
bones of the body appropriately without overloading them because then you can get stress injuries or stress reactions or
Oh,
even stress fractures.
sure. Okay. And then how often do you recommend these exercises be performed to, keep that bone loss from happening?
You really want to do resistance training at least 2 to 3 times a week, but different activities you want to be active. So just being active helps protect against bone and muscle loss. If you're ever bedridden or you're not up and about, that's
Hmm.
going to be detrimental in of itself.
Hmm.
But from a standpoint of trying to actually add some bone density, you would want to do at least 2 to 3 times a week of structured resistance training.
Okay, great. And then, of course, probably like you're saying, just move as much as possible. If you're maybe have a job where you're at the desk all day trying to get up and just, move that so you're not
Break
sitting
up the
all day.
sedentary periods.
Yeah, I know. I struggle with that is, a lot of my job is writing, so I'm sitting at that laptop and, you kind of get in a groove sometimes and then you realize, wow, I haven't gotten up in a couple hours and, it's achy and it doesn't feel so good. Um, so if a woman is new to weight bearing or they've never done any sort of resistance exercise, maybe they've always just either, walked or swam or did something a little bit more low impact, how could they get started on adding that into their, exercise and their lifestyle?
Yeah, that's a good question. So I think the easiest way to do it is with machines. So
Okay.
with free weights, you have to develop that mind muscle control to really stabilize them. But with the machines, they're pretty simple to where if you set the seat height and the arm settings to the right height, it's really just pushing through the movement and you don't have a whole lot of stability issues. And that's a nice way to start because then you can load appropriately with less risk of injury and then you can kind of progress from there.
Hmm.
If you don't have access to machines, you could always pick up some bands, elastic bands, and that's
Hmm.
a good way to get started. Body weight movements are always an option, but sometimes if weight's an issue, you want to be careful of how you load the joints because you can't really modify your body weight.
Right.
Whereas if you're doing something with a machine, you can lighten the load. Body weight stuff, you're kind of you have what you have, and if it's too much of a load, you could get an injury. So I would suggest really investing in a membership to somewhere that is convenient geographically.
Yeah. I know my mom, she was always a walker and a spinner, or more like riding the stationary bike. But after she retired, she was able to, at a certain age, to get, and I can't remember what it's called, and I apologize to our listeners, but when
Silver
I find out,
stickers.
yes, that's it. Yeah. And it's several dollars a month, maybe five. And she gets access to the local Y here, as well as like a community senior center they have where
Yeah,
they also have. So that's a good option for those looking for that. And they have a lot of the machines
yeah,
there. Yeah, great. So, say someone is already diagnosed with osteopenia. So that is the like a pre-osteoporosis, correct?
correct.
Right.
It's based on the bone density, and there's different levels. Once you reach certain ranges of decreased bone density, then you get into the osteopenia range, and then the osteoporosis.
hmm So if they've already been diagnosed with osteopenia, not quite osteoporosis, what can they do to maybe help prevent getting osteoporosis in regards to exercise or lifestyle?
Yeah, the same things you would do to build it. You
Okay.
just want to be more cautious and not overly aggressive, because if you have osteopenia or osteoporosis, it does mean that your bones are thinner, they're not as dense. So if you're too aggressive, you're more at risk for frailty fracture.
hmm
Not so much with the osteopenia, but osteoporosis, depending on how severe it is.
hmm
So you want to gradually increase, and if you do it gradually and you allow adequate rest, it's very safe to do.
Okay.
But really loading the bones and making sure that you're optimizing from a dietary standpoint with your calcium and vitamin D, and it's best to
hmm
get that from foods.
Right. Yes. And for our listeners out there, you know, if you've been listening to us for the last two seasons, we have, calcium calculator and lots of information about vitamin D on our website. So that's speaking of womenshealth.com. So I guess the same would go then for osteoporosis. If you're
Yeah.
already diagnosed with it, start off slow, talk with your, physician about, how you can build up and then get to maybe.
And then when you get to the like actual osteopenia and osteoporosis, you want to talk with your physician about medications that might be appropriate for you. They could actually slow down bone loss, or
Mhm,
actually they're anabolic agents that can actually build some bone density. But that's really a discussion that you want to have with your provider, depending on other medications you might be on, comorbidities. It's all everything's risk versus benefit, and
mhm,
you want to have an informed discussion.
mhm. Can you sort of reverse osteopenia or osteoporosis with exercise? Sort of
You
aside
can,
from maybe the medication part, but.
depending on your age and the
Mhm,
degree, and the underlying reasons, you can increase bone density, though it's much more effective to do in an early age.
mhm,
But regardless, you definitely want to incorporate it because of the health benefits, but also the bone density benefits.
mhm. Right. And then, as we get older, the amount of fractures, falls, and that, so if you can stop that before it becomes a problem and having to do surgery. So, well, this is great. So the next subject I think we want to explore is sarcopenia, which is sort of the muscles, right? Am I correct? You're losing muscle as you get older, or can you explain a little bit more about what that is?
Yeah, so age-induced muscle wasting, as you get older, you start to lose muscle mass also.
Mm-hmm.
Your cells are older, your hormones change, and you don't have that anabolic effect to maintain muscle mass. One thing that really helps with slowing that rate of muscle loss is resistance training, because you load the muscles. The muscles are an endocrine organ of their self, where they'll actually release myokines, and they'll activate growth pathways. And that's a big thing to think about when you're thinking about body composition. If you're not exercising and you're eating calories, what do you think you're telling your body to do with those calories?
Yeah.
To store those calories in your fat cells.
Yeah.
But if you're doing resistance training and you're loading the muscle, and you're eating calories and specifically adequate protein, you're sending cellular signals to build muscle, to take those nutrients and actually build and repair and make larger muscles. So it really kind of communicates with the rest of your body to try to build muscle rather than letting the muscle kind of deteriorate as you age.
Mm-hmm.
And it's not just the muscle mass. So you do lose muscle mass as you age. It's really the strength.
Mm-hmm.
And you actually lose strength at a higher rate than you lose muscles. And that's the important factor to look at. And it's overlooked a lot because it's not often assessed. So
Yeah.
bone density, you can get DEXA scans, and then you can
Right.
get scans with bioelectrical impedance where they measure body composition. They'll give you muscle mass, but not too often are um, people getting strength assessments.
Hmm.
That's something that we offer at the Cleveland Clinic, where we do 1 rep max strength testing for all the major muscle groups before we put together an exercise prescription. And your exercise prescription is based off of those strength measurements. And then we'll reassess you at 3 months, 6 months, 9 months, 12 months, and then to actually see the improvements in strength
Yeah.
and function.
So what kind of tests are those? I mean, I've heard grip strength before. Is it sort of something like that how you test the muscle
Well,
strength?
we actually take it quite a bit further than that. So grip strength is there's a lot of association with grip strength and the rest of the body, whole body strength, more so that as you lose it.
Hmm.
So as you lose overall muscle mass and strength, you lose grip strength. But we actually do an assessment. We have programs and equipment. We can measure one rep max strength for each piece of equipment. So similar to the types of machines that we were talking about, where you would do a chest press or a bicep curl or a seated row.
Right.
We have equipment that's called, it uses a mode called isokinetic testing. Iso meaning same,
Hmm.
kinetic meaning speed. So no matter how hard you push or press, the machine moves at the same speed. So it can calculate how much force you generate.
Hmm.
I don't know about promoting brands or anything, so I don't necessarily want to say the company's name that makes the equipment, but that's
Right.
information we can share afterwards on the website. But we have a pretty elaborate exercise assessment and prescription program, and all that data gets tracked and it goes to a cloud. And what we're doing is integrating that cloud with our electronic medical records. So all your exercise assessments and training gets pulled into your patient charts so that we can really kind of connect the exercise and medicine and really deliver exercise as medicine is a real prescription.
Right. Right. Sort of like like do 3 reps of this on
Yep.
Monday. And yeah,
Yeah.
that's great. Yeah.
So the equipment's so advanced that once you do the assessment and we make the prescription, it gets sent to your account. And when you walk into the gym, you scan with your phone and it tells you
Mm.
which machine to go to. It adjusts the seat height on the machines, the
Wow.
arm settings on the machine, loads your workout on, and it guides you through the rep. So the concentric phase and the eccentric phase. So as the joint angle shortens and as it lengthens. So
Hmm.
it teaches you to do resistance training, not just weightlifting. You have to control the load, and it's a safer, more controlled way to train.
Absolutely. I mean, I feel like I hear a lot, at least from my friends and family, they're going on Instagram or TikTok or whatever social media, and they're like, oh, that looks like, oh, look at her. She's got great abs. I'm going to do that workout from this woman. And these women are girls, they're very young, and my mom is in her 60s. So I'm like, well, that's probably not the workout you should be doing. So, I feel like sometimes we're doing the wrong things for our body and our age and our muscle strength and our bone density. So it's pretty imperative to always, anytime before you start anything new, you should, talk to your physician about it, and maybe you need to see a specialist like yourself.
Yeah, and you make a great point. You really don't want to compare yourself to others, and you
Hmm.
don't want to exercise prescription or that was made for someone else or by someone else. It needs to be individualized for you, and the only way to do
Yeah.
that is with an assessment so that you know where you're starting, and then it's based off of where you're at,
Hmm.
and then you can monitor the progression. And that's really the biggest thing is consistency over time.
Hmm.
And that's what you hear a lot of comments about. Well, we know exercises work, but it works, but how do you get people to stick with it?
Hmm.
It's easy. You show them results. That's
Hmm.
why people become marathon runners and lifelong runners or weightlifters because they saw the results.
Hmm.
So by getting patients a baseline assessment at 3 months, they may not realize just how much stronger they got
Hmm.
until you reassess them and you show them that. And when they
Yeah.
see that, it's so motivating and rewarding to them.
Yeah. And I know I've noticed as I've gotten older, I was a runner, through high school and until now, and I'm just, I'm kind of plateauing. I'm seeing my body's not even staying at the same weight or muscle mass. I can see it getting worse, but I'm not exercising any less. So, the last, I would say 5 years, I've started, doing this bar Pilates where we use resistance bands and weights. And I do yoga, but I do that just because I like it for the calmness and my
Yeah.
mental health. But I do see a difference if I'm not going and doing that resistance training after, if it's been 2 weeks, 3 weeks, I can totally tell the difference. I plateaued again. So I think, like you're saying, keeping up with it. And then as you hit a certain age, you may have to, change up that routine. Yeah.
And as people age, they can still build muscle and
Hmm.
get stronger. The thing is, and they can train hard too.
Hmm.
The difference is they need a little bit more recovery time. So, where if for a hard workout when they were younger, they may have been able to train that same muscle group 2 days later, sometimes
Hmm.
it may take another day as you get older. But if you gradually increase and you're consistent, you can train hard. You
Hmm.
just have to make sure that you're also recovering before you train hard again.
Yeah, that's a good point. That's a good point. So, sort of going back, I mean, we've been talking about sarcopenia, but who does it affect? Females, males, certain ages, certain anybody?
Everyone, yeah.
Okay.
So it
Okay.
comes down to age. So really, after your mid 30s, you start to see a decline in muscle mass and strength unless you're actively doing resistance training. For women, they see a significant decline after menopause.
Hmm.
And then when you get to like your 60s, it kind of accelerates more and more. Men, as they age, they kind of have a more gradual loss of testosterone, which is really their anabolic hormone that signals muscle growth. And for women, it's the estrogen that's their anabolic component. So
Hmm.
postmenopausal, if they're not doing resistance training, they will see a rapid, very rapid decline of muscle mass. And it's actually impressive just how much resistance training can offset that decline. If you would
Hmm.
look at two individuals as they go through menopause, if one is doing a well structured resistance training program versus a female who isn't, it really changes how they age. Because the thing about muscle mass is there's 2,500 calories in a pound of muscle, there's 3,500 calories in a pound of fat. The more muscle you have, the more calories you burn because muscle is very metabolically active, where fat is not. So if you
Hmm.
have a certain amount of muscle and a certain amount of fat, and your hormones change and you're no longer maintaining that muscle mass and you're not doing resistance training to maintain it, not even counting the calories you burn through the resistance training, you're going to notice that you feel softer or like you're more fat
Hmm.
because what's going to happen is your body's going to be burning that muscle mass for energy instead of the fat. And for every pound of muscle that the body burns or doesn't maintain, there's 2,500 calories with that. So instead of burning that 2,500 calories worth of fat, it's coming from your muscles. So even if you're not eating more and not exercising less, your body composition can change because you're not supporting previous muscle mass that you did have.
Got it. So now you're making me want to like really re-up my resistance training, but can you do too much of it? If I decided to do it 6 days a week, is that too much?
That's a loaded question, so we have to approach that in steps.
Hmm.
So I think the biggest concern that females have is they don't want to get too bulky.
Hmm.
You won't.
Yeah.
If the concern was getting too bulky, people wouldn't turn to anabolic steroids.
Hmm.
It's hard to build muscle, especially if you're in a caloric deficit. If you're trying to lean out and you're in a
Hmm.
caloric deficit, it's hard to build muscle.
Hmm.
And then for females, you don't have the the genetics of a male. So you don't have the testosterone. That's why women have they can get comparable leg strength if they really train well, but there's always going to be a deficiency in upper body strength because you have a lot of your androgen receptors in your deltoids and your
Hmm.
upper arms and your traps. So if you look at athletes who abuse steroids, they have very large traps and very big deltoids. And if you look at females, they kind of have slender arms. Um, that's where the androgen receptors are. So don't be
Okay.
afraid to lift weights. You're not just
Yeah.
going to swell up overnight.
Yeah.
And you may feel that you're bulky. A lot of that is because you're increasing the muscle glycogen stores. Okay, so the more you use the glycogen, which is stored carbohydrates in your muscle,
Hmm.
your body adapts and it stores more glycogen in the muscle. And 1 gram of glycogen holds 3 grams of water. So your muscles can swell up, and that's kind of the pump that you feel when you're lifting, that increased blood flow and that pump.
Uh-huh.
So your muscles may become more fuller, and you
Yeah.
may feel that you're kind of blocky and bulky. But as you continue to improve your diet and lean out, you lose that layer of fat or adipose tissue over the muscle, and you realize that you're not bulky. And you really want that muscle mass because as you lean out, you don't want to be left with kind of a low level muscle mass. And that
Yeah.
kind of gets into a whole discussion about weight loss and some of those GLP-1 medications that we could go
Mhm.
into now or later on, depending on how you want to proceed.
I mean, that's really interesting. That's actually a whole podcast episode I do want to have. So, I mean, I wouldn't mind diving into that because I know we're getting a lot of questions on our website about women asking
Good.
about these. I mean,
So with the GLP-1s, they're great at what they do. It's
mhm,
an appetite suppressant. So when you eat, your stomach and small intestines, you release these hormones that make you feel full called incretins. Tells your brain that you're full. Now, some people, they'll eat and they'll always be hungry. It could be because they don't make enough. So when they eat, they don't release these hormones and they never feel full.
oh,
Some people could be resistant. So they eat, they release an adequate amount, but they don't respond to it. Kind of like in diabetes, people who
yeah,
need insulin
mhm,
because they don't make enough, or people who don't respond to the insulin that they do make. So that's why you have to start at a very low dose, because if you're someone that just doesn't make this hormone when they eat, you're very sensitive to it. So the
yeah,
smallest dose can have a profound effect.
yeah,
And then some people, they could be on the highest dose and they really don't notice an effect because
mhm,
they already make a lot, they just don't respond to it. And giving someone more of something they respond to is not going to have as much of a profound effect.
hmm,
And the thing is, most of them are once weekly injections, so you can't uninject it. So if you're overzealous and you think, oh, I'm always full, I mean,
yeah.
I'm never full, I'm always hungry. I don't want to start with the low dose. Always start with the low dose, because if you're just someone that doesn't make it, even sometimes a fraction of that starting dose is enough.
I mean,
And
oh,
yeah,
go
go
ahead.
ahead.
No,
No,
I was
you
just
you
going
go
to
ahead.
ask, so then when they're starting on this and they're not eating as much, so then, I mean, I would imagine that has to somehow affect like their bone density or their muscle mass, because then, like you were saying, you have to intake so many calories to keep up with building that muscle, right?
Correct.
So,
And that's kind of the next thing I was going to say. People say that they don't want to take it because of that you lose muscle mass.
yeah.
And the studies show that the way those studies were all designed by the pharmaceutical companies, there was no resistance component. They told the patients to eat 500 calories less a day and to be active 150 minutes. Nothing about resistance training. So
Uh,
the thing is, they lost a lot of weight, but about up to 30%, a third of the weight was lean mass.
mm,
Now, it's not the medication's fault. The medication did its job, it suppressed your appetite.
mhm,
It doesn't matter if when you're in a caloric deficit, you're going to lose weight. Whether it's willpower, bariatric surgery, poverty, pills, injections, stranded on a desert island,
mhm,
your body doesn't care. It just knows it's not getting enough calories to sustain life.
mhm,
And your body's smart. What it learned was that it wants to make you as efficient as possible so that you live long enough to find your next meal. So the more muscle you have, the more calories you have to consume to maintain that muscle mass.
Mm-hmm.
And like we talked about, there's 2,500 calories in a pound of muscle, 3,500 calories in a pound of fat.
Mm-hmm.
And it doesn't take anything to maintain fat mass. So your body knows that I can get energy from burning this muscle, but not only that, I can decrease the amount of energy that it requires for me to remain alive. So your body will start burning that muscle. Unless you're using the muscle a lot,
Mm-hmm.
you release myokines. And basically, what your muscles say, hey, I understand I'm starving to death, but I'm using these muscles a lot, probably to try to find food, leave the muscle alone, and burn the fat. And
Okay.
you have to remember all the muscles. So if you only train your legs, you're not going to protect your upper body. You have to train the whole body because you can maintain the muscle mass in the legs, but if you're not training the upper body, you're going to lose muscle mass and bone density that way. So that's where the problem is.
Mm-hmm.
These medications should never be prescribed unless somebody's in a structured resistance training program. The cardiovascular exercise has its benefits from health benefits and a whole bunch of other stuff. But if you're just doing cardio and you're taking these medications and limiting your diet, those are just increasing that caloric deficit. You're not protecting your muscle mass.
Yeah.
So that
Yeah.
that's the important thing, that inadequate protein. And what we see with the patients we have and the data we have and in the exercise environment we created, with or without these medications, if patients can create a caloric deficit, they'll lose weight. If they follow our structured exercise program or any structured resistance training program, they'll improve strength while losing weight.
That's great. Thank you. It's really, I mean, it's really interesting, and we should do like a part two about, side
Absolutely, yeah.
effects, right? Who are candidates? Because, we see on a lot of these TV shows and, celebrities on, in the media, they're saying they're going on these pills. Well, they sure didn't, or, the medicine, they sure didn't look like they needed to begin with. Maybe just a little extra exercise. So,
And the important thing to point out is these medications, just like I explained, some people don't make enough of this hormone and some people are resistant.
hmm
Like any medication, when the medication binds to a receptor, that your receptors downregulate. It's called tachyphylaxis. So you get a decreased response to that medication over time. And there's some
mm
people, that's why you continually increase the dose. You develop a tolerance.
yeah,
And you got to think about this long term. If that's the only tool in your toolbox that you're using, what's going to happen when you're at the highest dose and you're still hungry? And
right.
worse yet, what's going to happen if you didn't do resistance training? Now
hmm
you lost fat and muscle.
hmm
You didn't increase your exercise capacity to protect against that weight regain by being more fit and being able to burn more calories. So now, when the appetite comes back, you're going to gain fat back. So you lost fat and muscle, and now you're a year older, and fat's going to come back.
Uh,
Versus if you maintained your muscle mass and you improved your fitness. So when you first start, you may exercise hard for 30 minutes and may only be able to burn 200 calories. As you get more fit, if you exercise hard for 30 minutes, it's the same duration, the same intensity. 30
mhm,
minutes hard. But hard's relative. You're more fit now. You have different metabolic machinery. You have more mitochondria in your muscle. The reason you can run faster is because you can burn calories faster. So
uh,
now for that same hard effort, for that same duration, instead of 200 calories, you can burn 400 calories. And now you don't hate exercise, and you have the endurance, so you could exercise for an hour. So
mhm,
now you're talking 600 calories. So that's more of a meaningful caloric expenditure to protect against the weight regain that occurs when the appetite returns.
mhm,
Plus, you preserve your muscle mass. So
right.
again, in no situation should these medications be prescribed, because if you do take them and you lose muscle mass,
Mm,
and it's years later, and the appetite comes back, the patient's worse off than if they never would have met that physician, because at
mm,
least then they would have had the muscle mass they lost in the process.
yeah. Well, it's really, really interesting. Um, so want to switch gears a little bit and talk about cardiorespiratory fitness. I had actually not. ever heard that word before. So I'm sure many of our listeners are in the same boat as me. So how does this play an important role in exercise? What is that role? Why is it important?
It's huge.
Yeah.
The American Heart Association released a position statement in 2016 that identified cardiorespiratory fitness as important of a risk factor as smoking, high cholesterol, blood pressure, and diabetes. So the other four we put a lot of effort and energy in to addressing,
Yeah.
but rarely do we do assessments for cardiorespiratory fitness. But
Mhm.
again, in our program at the clinic, we do that, a baseline cardiorespiratory fitness assessment. And there's so much that we can talk about from that standpoint
Mm.
with fuel substrate utilization and everything else. But essentially, cardiorespiratory fitness is a measurement of your aerobic capacity, how efficiently your heart can circulate blood from a good stroke volume, a contraction, how well your lungs can remove carbon dioxide and oxygenate the blood, and how efficient your muscles can extract oxygen out of the blood and utilize it. So it's a whole body representation. And what it is it's a measurement of how much oxygen you convert to carbon dioxide. And you can get a tremendous amount of information by measuring that. So
Mm.
I can go into more detail, or we could do a whole podcast just on that.
Yeah.
But
So is it
with
like people who are in better shape or maybe people who do more cardiovascular
correct.
exercise? Okay. Yeah.
So it's a relative term relative to your weight. So you can improve your cardiorespiratory fitness by improving your body composition. So if you lose weight, your VO2 max will go up. So your VO2 max is the maximal amount of oxygen that you consume and convert to carbon dioxide at peak exercise. So and it's relative to your body weight. So at rest, you consume about on average 3.5 milliliters per kilogram of body weight of
Mm.
oxygen per minute to sustain life. So the heavier you are, the more oxygen you consume. So if you're more metabolically fit, if you lost 20 pounds of fat and maintained your fitness, didn't change your fitness, your VO2 max would go up. Your cardiorespiratory fitness would go up because your body weight's the denominator. So if you look at simple mathematics, if you decrease that denominator, your overall value goes up. So it's relative to body weight. So you can improve your cardiorespiratory fitness by decreasing your body weight. And that's things that people notice as they lose weight. They can do more and it doesn't feel as overwhelming.
Hmm.
But you can get a lot of information. So if you do a resting metabolic test,
Hmm.
which measures how much oxygen you convert to carbon dioxide, different fuel substrates require different amount of oxygen to fully oxidize it. So fat versus carbohydrates. So if you fully oxidized one glucose molecule, it has 6 carbons in it. That requires 6 moles of oxygen, okay,
Hmm.
and you produce 6 moles of carbon dioxide. So essentially, when you do the math, the chemical stoichiometry, you
Hmm.
divide the carbon dioxide that you produce by the oxygen you consumed, and it comes out to a value of 1.
Okay.
So fat, it's a little bit different. You don't need as much oxygen to burn carbohydrates as you do fat. Okay, so the denominator is bigger, so the value is lower. It gets down to zero point 0.7. That's called a respiratory exchange ratio. So at rest, you can actually determine what fuel substrate someone's utilizing. If you're burning fat like you should be when you're fasted,
Uh-huh.
or if you have metabolic dysfunction and you're relying more on glucose when you should be burning fat. And as you fix people's metabolic dysfunction or diabetes, you
Hmm.
can see that value improve. And then you also, that's how you figure out how many calories someone actually burns. You measure how much oxygen they consume. For every liter of oxygen you convert to carbon dioxide, you burn 5 calories. That's where all those estimations come from. There's actual measurements that we do.
Hmm.
So you get that at rest. So if I measured how much oxygen you convert to carbon dioxide over a 10-minute period, and then I extrapolate that out over a 24-hour period, I could tell you exactly how many calories you need to sustain your weight
Hmm.
without activity. So
Okay.
now it's way more accurate. Now, if I did that same type of test on a graded exercise test where I gradually increase the workload, I can watch your fuel substrate shift to where at low intensity you're burning fat, and as your intensity increases, you start burning carbohydrate more and more. And I could tell you where you start to produce a lot of lactic acid and all these
Ah,
different training zones. So that's where you get these different zone 1, zone 2, zone 3, zone 4, zone 5. And I could find exactly what heart rate and what workload you burn the highest percentage of fat.
huh.
So it's not about exercising as hard as you can. It's really about staying in kind of this fat burn zone, this zone 2. And that's going to stimulate a lot of mitochondrial biogenesis. You make more mitochondria. And that's how you would stimulate increasing your aerobic capacity, your VO2 max, your cardiorespiratory fitness. That's why these endurance athletes do these low, slow runs. They don't just walk out the door, take off running as fast as they can for as long as they can.
Yeah.
It's different athletes, different metabolic pathways, aerobic versus anaerobic. That's why you have elite sprinters and you have bodybuilders and you have ultra endurance athletes. That's why marathon runners don't look like bodybuilders and bodybuilders can't run marathons.
Right. I mean, I notice on my Fitbit when I'm running, I will it'll say sort of what you're saying, some of these terms, but
Yeah,
it'll
very inaccurate
okay.
estimations. And they keep running equations based off of the workload that you're doing and what your corresponding heart rate is and your age and all these things. And it just makes guesses. The
Yeah.
real way, if you wanted accurate data, would to be to have a metabolic assessment done with a metabolic cart where we actually measure that. So we would measure with a mask how much oxygen you convert to carbon dioxide and be real data. And during the test, if you'd have a heart rate monitor on, so then we would have a heart rate to correlate with all those values. So we could tell you to train at these heart rates.
Mm. Yeah, I mean, goodness gracious, if we're all exercising and putting all this time and effort, and I'm not even doing it to the most best way I possibly can to either lose fat, then I mean, that's really frustrating. It's making me really mad right now that I don't know that.
Because some people could be training too hard and outside the zone, and that's really fatiguing. I mean,
Yeah,
there's certain benefits that you get from that, but it may not be what you want. You may want to stay in that low zone too, where you can do it for a prolonged period of time and you're not as fatigued.
yeah.
But when you increase the intensity, puts a much larger stress on the body. That's why you can't sprint indefinitely.
Hmm.
It's a big stress on the body, but you could walk for prolonged periods of time.
Hmm.
But walking may be too low intensity. You want to find at what heart rate, at what workload, the percentage of fat is oxidized, and that's your fat max zone.
Hmm. And the only way to really get that, as you said, is through this metabolic test.
The only accurate way. Otherwise,
Accurate.
you're just making guesses and estimates. Even your heart rate max based off your age. Those huge standard deviation variations to where for 95% of the population, there could be someone that could be the number you're telling them is off by 24 beats, either too high or too low. For
Mm.
someone, it's going to be just right, but
Yeah,
you have to look. It's a bell-shaped curve,
yeah.
so it depends how lucky you are.
Yeah. Wow. Great. Well, I know we wanted to talk about female athlete triad, but I know I'm going over my time limit with you. So we'll have you back on the podcast to talk, even more about this. And we'll talk about, more, on these weight loss tips using, various other methods. But before we wrap up, is there anything else or any other words of wisdom for our listeners that you would like to share, Dr. Kampert?
I think consistency is the key. A lot of times people will get real motivated and they just want to make up for lost time.
Hmm.
And you put too much of a stress on your body. So you can't burn the candle at both ends. You don't get stronger or more fit while you're working out. It's actually the opposite. It's when you recover. So you have to make sure you have structured recovery. Otherwise, you're going to get an overuse injury. And you lose that fitness quickly. So you can lose a month's worth of work by being injured for a week. So
Yeah.
if you get injured and you can't work out for months, not only do you miss out on that progress, you lose a lot of the gains that you have. So the key is to stay injury free and to be consistent. And from a dietary standpoint, if you have a bad meal, don't turn it into a bad day. You can undo a month's worth of hard work with one bad week of eating. So I mean,
Mhm.
you just see it for what it is, that you did something you didn't want to do,
Yeah.
and then get refocused. And sleep plays a big role in your ability to regulate your appetite, your mood, everything. So you really want to prioritize sleep and stay hydrated.
Hmm. That's great. Yes, very true. So, and if our listeners were interested in making an appointment with you or learning more about you, how can they find you online, or is there a phone number that they could
Yeah.
reach you at?
So the clinic does a great job of promoting us. So they have, if you Google like Cleveland Clinic, and then my name, Matthew
Hmm.
Kampert, sports medicine, you'll get linked, a video come up eventually on Google that has like our profile and even a video, of us kind of talking a little bit about ourselves and our practice. As far as social media, I don't get too involved with that. I do have
Yeah.
something on LinkedIn where I'll post like articles and things that we publish. But yeah, from an appointment with us, the best thing would just be to look online. And
Mhm.
the local news has done a couple news stories on the gym and the equipment, so I can
Oh,
provide
great.
those links to you if that's
Yeah.
something you would want to share. It'd
Yeah.
be really informative, and you can see some of the patients that they interview and the outcomes.
Yeah, that's great. And yeah, and I'll put for our listeners in our show notes, I'll put the link that Dr. Campert is referring to on the Cleveland Clinic website, where you can find his video and his information and phone number. So, well, thank you so much, Dr. Camper, for joining me on the Speaking of Women's Health podcast. And it was a very enlightening episode, and we'd love to have you back. And we do appreciate your time and your tips. And thank you to our listeners for tuning in to another episode. And be sure to subscribe to our podcast if you already don't. And it's free, and you can subscribe wherever you listen to podcasts. Thank you, and we'll see you next time in the Sunflower House. Be strong, be healthy, and be in charge.